sir. How are you?
I'm good, good. How are you?
Fine, sir. Your good name?
Prakash.
Hi, Prakash. Where are you from?
From originally from Namakkal, but currently I'm staying at Canada.
Okay, you have become a resident there?
Yeah.
Okay, what work you are doing, sir?
I'm working as rail signaling. So the company is actually based on doing automation of driverless trains.
Okay.
So we are doing producing softwares for those.
So trains will go without
drivers. Yeah.
drivers.
It can be controlled automatically. It's based to automate the signals, and the driver can just sit and just watch.
So you had a problem with your lower teeth.
Right.
You had a root canal done, and what was the exact issue you had?
So initially, I had two teeth, RCT before. One of them got broken because of I had a pain, and then I went to the doctors, and then while trying to remove, when they attempted to remove the cap, the RCT cap, it got broken. After then, I wanted to do implant for the broken tooth. Later on, I been hesitating to go to hospital for after like 3 to 4 years. When I come back and take the CT scan, found that there is a cyst in the lower front teeth.
Okay.
So,
Okay, I'll just explain them. See, the problem here is he had a root canal done on the lower teeth. So he had a cap also. Suddenly he developed a pain. So when he went, they tried to remove the crown. And when they removed the crown, they broke the tooth. So once they broke the tooth was broken for a long time. So what happened? The infection was going inside the tooth into the bone. So Prakash didn't go there, and he developed a big cyst. He had a very big cyst here, very big cyst. So that cyst has almost eaten a lot of his mandible jaw. So what we did the enucleation of the cyst. Let's ask his experience now. Prakash, we took a scan and we saw it's a big cyst. So when we told the cyst is very big, this is to motivate others. So you please tell me exactly, honestly, what thought came into your mind first?
When I come here, before I come to you guys, I was also aware that after looking into the scan results, I was really scared, to be honest. But one thing I know is that it has to be done properly, in correct way, which is why I wanted to remove as soon as possible. So the first step is to remove the cyst. Now obviously, as you said, we have to do the bone grafting so we can have the natural bone to be grown.
We did an extensive procedure for cyst removal. Then we did bone grafting using your own bone plus other source bone also. And it was a huge success because we planned it well. And the planning was well because you have informed us and you planned it well. You too came and gave us some time. And I expect all the people who are traveling, especially, please go to the dentist on the day you come from a foreign country. Go to the dentist so that they plan. Most of them, they come just before they leave the country. So we have to understand that if you think like that, then there will be less time for the dentist to work, so that the outcome will not be as good as what you are expecting.
True, agreed. The reason for traveling here, the main reason is to actually have the cyst to be removed. That's the main reason to come here to India, basically, this time.
One more question to you is, why you didn't prefer to choose the dentist in Canada?
Well, as everyone knows, that in North America, it's mostly dental. When you go to any dental hospital, it will be too costly. One thing. Second thing is,
what was the code they gave for this extensive surgery?
So they gave me like a total code, including bone surgery, and they gave me a plan as well, everything. But before that, they also gave me for cyst removal, I guess, around 2-3 lakhs or something like this.
2-3 lakhs.
It's
Oh my God.
okay. That will be, it's nominal, to be honest. It's
In there,
common. It's okay in there, because in, like, when it comes to dental, it's really costly.
so you prefer to get it done here. One is because of the cost, and one is because of the expertise available here.
Correct. And also with no time as well, right? And if I have to go there, I have to book a nurse. I have to pay them in advance first, and then
So you need a nurse to take care of you.
to support, to give me anesthesia and everything, local anesthesia, and then we have to book everything. It will take like a month, few months, obviously. In order to get appointment to the doctors as well itself, it will take a lot of time. I know when I come to meet you last year, you were like, okay, can we do it today? Like, when I first met you, you were like, okay, I'm ready to do anything, let's do the implant. I know we have to do the implant after doing the scan, and obviously when I did the scan last year itself, I would have known that there is a cyst in there, and it would have done.
Last year after I saw you didn't turn up with the scan. You went back.
No, I did not do anything. I didn't do any scan.
So how's the surgical part? The pain and things like that.
Surgical point right now, I guess last two days it's been okay. It's better, like day by day it's really getting better.
No, I'm asking during the procedure how did you
During
feel?
the procedure. Oh, man, it is intensive procedure, and it's good. At the end of the procedure, I really felt good. But I felt also the the procedure was really, it's time consuming, and also it's something really big, obviously. But I am kind of aware of, I was mentally prepared, to be honest. If you asked me to do the same cyst removal like 2 years before, I wouldn't even coped up with you during the surgery. I would have get this.
One thing I want to appreciate him is he was very cool from the time. He was not feeling any surprise at all. Prakash was very prepared, as he said. He was mentally, and as a doctor I observed him. He was physical and mental temperament was even more better. Very calm, composed, and he was well planned. He in the timings and everything. So it was very nice to work with him when we were able to handle a lot of pressures during the surgery. Let's ask him about the prosthetic part, the teeth part, which we did today. Over to Prakash. How you feel?
Right now, yeah, I'm more confident about even to talk.
To be frank, as I'm looking at him in this interview, his teeth are looking quite normal, as if he's having a natural teeth. And right from this distance, nobody can ever say he's having an artificial teeth or fixed teeth. Yeah. And it's so good. Can you give a smile for us? And since it's a lower, it's not visible at all. And so yeah, how you feel after you saw the?
After I saw, it's good. And as I said, you explained me on the first day itself, so there is no surprise. The only thing is, like, I was a bit kind of after saying today that the silver part, I did not expected that, because I was not.
Which one? I'm not.
This silver part inside.
Oh, okay.
But I guess that's.
Okay.
I know some of my friends had the same thing. So, which is why I didn't say.
Okay. See, actually, the silver part is for reinforcement.
True.
We can give a plastic part, but it will not withstand for a long time. Maybe for a couple of days. For we have planned for you, at least for next year when you come back for the implant, it should stay. That's why we gave a.
Yeah, I right away I understood that. It makes sense.
It's not visible for you.
Yeah,
true. You don't have to worry really. And one more thing I wanted to ask is, what's the options we gave? It's okay. Like, are you comfortable with the way we explained and showed you various options?
Right.
Uh,
I fully understood, and whatever options you gave me, it all makes sense to me. Obviously, I just don't blindly come to you, and I don't blindly believe you. Obviously, yeah, you guys are expert, but for me to believe in you, I need to understand fully. Only then I will come back to you.
Yes.
So, which is why I came back to you. But yeah, thank you. The one thing I never forget is that cyst removal operation that was intense, and I feel really good, very good. Like it's a huge thing.
So thank you, Prakash.
Thank you.
You are a very wonderful patient for us, because people who are educated and do research and plan and come are very easy to work with.
True.
They are prepared mentally, physically, financially, and lot many things are in our favor.
Yeah.
And we like to work with such patients who understand the difficulty of us, so that our wavelength becomes better.
I totally agree. I know the responsibility you guys have. As you said, as you mentioned even before, we shouldn't bite, and it's patients. It's our responsibility as well after the surgery is done. We cannot complain you. I know you did your part really good, and we have to take care of our.
There are a lot of complications we see during a cyst removal, especially the extent of the cyst is, though well planned with the CT scan, we know exactly how big the cyst is. So we need to prepare the materials, the graft, the membranes, and all this has to be procured, and we may have to procure a little extra. And there are things which are available which would really help us to do it very successfully. For you, we have used a Micros bone scraper, which we gave us a lot of bone. It's like gold coming out of your mouth.
Yeah.
I'm literally telling you, that's really super awesome thing. And almost we have done it in a very few cases, because it's very expensive. That once used material itself is around 5,000 rupees. That we have to, it's a blade, that's all. So since you are an international patient, we wanted to treat you with international standards, especially with the terms of surgery, planning and everything. And even we have a nice setup to work now, where we can literally do anything. We are doing a lot of surgeries now, almost every week, lot of work we are doing. So our team is also well trained, and our team is also focusing on the sterilization part and so many things. First of all, I thank you so much for the trust you have on us, and thank you for this beautiful testimony, which will really help in many patients to boost the confidence. Because what we say doesn't matter, what you say, it's the matter, because patients will trust the other patient only. So thank you very much, Prakash.
Thank you.
All the best for you.
Thank you again.
We'll see you up in next year.
Yeah, for sure.
All the best, and for your project also.
Yeah.
We'll wish you'll come to Canada and see your
Yeah,
train,
it's in-
driverless train.
Yeah, I mean even in Hyderabad Metro,
Okay.
where everywhere.
Okay, there's
Dubai.
no drivers.
Dubai, no, in Dubai, I mean, drivers are there to open the door and close the door, just in case if emergency, if any passengers get stuck in the door while closing the door and stuff.
The rest everything is AI only.
Yeah, automatic control. Yeah.
Good to know all that the updated technology. Thank you. God
Thank you
bless
so much.
Okay. So dear friends, I hope you had a nice interview. So any of you have any surgical related issues in dentistry, please approach us, and we have all this expertise to handle your cases. And thank you so much. Please like this video, and if you have any doubts, put it in the comments column, and give us a subscribe thumbs up, so that you get regular notifications of all the dental updates. Thank you, and God bless you.